Hi, Tina Ketchy Stearns, and today we're going to talk about palliative care and when is it time to call in palliative care, especially if you're in the hospital having surgery. So it's kind of confusing, and I'm going to try to make this as simple as I possibly can. Palliative care is a part of the specialty known as hospice and palliative care. So they pretty much go hand in hand. If you're going into the hospital for surgery, your surgical team is going to manage your care as far as your pain management related to the surgery. Let's say you were having open heart surgery. Well, there may be some medications that would not be a good choice given your heart surgery, where other medications would be better given your heart surgery. If you're going into the hospital for some kind of procedure, whether it's surgery or something else, and you have a potentially life-limiting illness, palliative care is going to be appropriate because there is that potential that you may be a hospice patient relatively soon. And to be a hospice patient, you need a 6-month or less prognosis to end of life, no longer seeking curative treatment. So if your kind of surgery has nothing to do, there's no fear that it's a life-limiting potential situation, then palliative care doesn't need to be involved. And like I said, your surgical team will manage your pain and symptoms while you're recovering from your surgery. Palliative care is really appropriate when whatever the situation is, there is a probable likelihood that you will be in a hospice type of appropriateness in a pretty short period of time. Now, it's a little bit gray, and there's a reason for that. Everybody's different. Every situation is different. But I know in the past you probably heard me say, the minute you are diagnosed with a serious illness, you should invite in palliative care. Some people got confused by that, so that's why I'm trying to clear it up now. Invite palliative care in early in the process when you've been diagnosed with a potentially life-limiting illness. But just because you have something going on that requires surgery, or whatever you have going on involves pain, maybe you've got chronic hip pain or chronic neck pain, that doesn't have anything to do with palliative care. That's the kind of thing when you want to go to a pain clinic or a pain specialist. So the palliative piece, really, I want you to think of it being kissing cousins and sisters to hospice. And if you remember, there's this sort of visual I kind of like to use. One of the medical providers at a hospice I worked with did this, and I thought it was beautiful. So if you imagine a big circle, I don't know if you can kind of see my big circle of my arms. Everything in this big circle is pain and symptom management, like even including the dentist, and they're going to pull your tooth and they're going to numb your mouth. So, that is pain and symptom management. That is a form of palliative care. But for palliative and hospice care, anything in this circle is pain and symptom management. Within that big circle is a smaller circle called hospice, which is 6 months or less prognosis to end of life, no longer seeking curative treatment. All of hospice is palliative, but not all of palliative is hospice. So you need somebody to numb your mouth at the dentist before they pull your tooth. Well, clearly you don't need palliative care as far as hospice and palliative care goes, but you sure as heck need somebody to manage that pain and symptom. You want to call palliative in when you might not be quite close enough to a 6-month or less prognosis, but whatever is going on with your serious illness, your potentially life-limiting illness, you do have some pain and symptoms that need to be managed, and you're just not quite appropriate for hospice yet. So I hope that cleared that up. Again, it's more art than science many times. Everybody's different. So I guess what I would say is if you have a question if palliative care is appropriate or not, then call in a consult and they'll be able to tell you. Now, you know what, you really probably need to go to the pain clinic. Or, yeah, I think we can help you out. So just call for a hospice consult and they'll let you know. So I hope that was helpful. I'm excited to be getting your responses about the topic you want to focus on for the live webinar that I will be announcing very soon, the date and the topic. If you have not yet weighed in on what you want that topic to be, you've got 4 choices. One is hospice and palliative care. Second is advanced care planning. Third is caregiving, and fourth is grief. So please weigh in on what you would like this live interactive webinar topic to be, and I'll be announcing that very soon. All right, thanks guys. Until next time, bye.